Hi everybody, Bill here, still here. Sorry about the hat. I know I've worn it before, but I wanted a Christmassy hat to wear and I couldn't find one. I haven't had my Christmas cracker yet, so this was the best I could do. Anyway, update. Well, I had a phone call yesterday from the Princess Royal Hospital, the admissions people. And I thought, oh no, here we go. 10th of January, they said, yeah, you know you got your surgery on the 10th of January. I thought, here we go, what's going on? We've got a nurses' strike going on in the UK at the moment. Lots of things, winter of discontent, lots of things. Ambulance drivers are out today, paramedics I should say. So lots and lots going on. I thought, here we go. But actually, they're putting the surgery back one day, that's all, so that's okay. So the surgery date now is the 11th of January. And also the venue's changed. I've got to report now to the Alan Cummings Day Centre at the Princess Royal because Danko's going to do the surgery within there. I said, in the day centre? That's where they just let people in and out in a day. Surely I'm going to be in for longer than a day. And I think I obviously am. I think what will probably happen is I'll be moved on to a ward afterwards. I don't know. I'll let you know. I did ask if actually it's nicer than the general wards are. Maybe this day centre's got sort of, maybe I'll get my own room, something like that. But I don't think I am going to get that. It's going to be the normal sort of wards because they do have people after recovering from surgery there. So the best I can hope for, and I think everyone else can hope for really, is that I get a window slot, bed near the window. For obvious reasons, it could get a bit stuffy in there with me in there. So for my fellow patients, I think it'd be a good idea to give me a bed close to the window at least. So that's the news about the surgery. So we're still all on for Christmas, although I am sort of shielding now, really. I've got to make sure I don't get ill. There's so much illness about. There's this awful flu type virus. I don't think it's COVID, but it's something similar, which is doing the rounds. Lots of people I know have gone down with that and they've been knocked out for a long, long time. I'm really keen to avoid that. I have to do COVID tests leading up to the surgery. I've got to provide 2 tests myself on the days before it, and also when I get there they've got to take my COVID swab, make sure I haven't got COVID. So I really don't want to do that because that will delay everything. So that's the news on the surgery. The other thing is, do you remember I said I'd been asked to be a patient rep? Well, I had that phone call from this chap from King's College Trust. He's not a clinician. He's not a clinical guy. He works in sort of. He's got an admin-y type role, but obviously probably quite a senior sort of manager, I should say. Don't want to put the guy down. But he's not like a doctor or anything like that. Now, what he's got to put together, and apparently it's from the NHS England. They've directed that all hospital trusts set up these patient reps. For personalised cancer care. That's what it's about. It's a focused thing in 3 particular areas. Very quickly, don't want to bore you. First thing they're looking at is what they call a holistic needs assessment. And this is where when you've just been diagnosed, it's where you sort of get an opportunity to say all the sort of factors that are causing you concern and worry, and then it helps the colorectal nurse team, in my case, know what it is that bothers you most. I actually had one of those right at the beginning. William Manibay gave me a call and we went through that together. So that's one area they're looking at. Second area they're looking at is something called, a treatment summary for GPs. So when you've finished your cancer treatments, it's like summing it up in one easy document for the GP and anyone else who needs to know what treatments you've had, what you've been through, any issues that went along the way, because there's so much paperwork and documents, isn't there, that is generated. This is like one concise guide that a GP, for example, could read and know instantly what their patient has gone through, to save them reading through lots of stuff which they haven't got time to do. And the third piece of work is about what they call a risk stratified follow-up. Stratified, I had to look that up. It's strata, it's stratified. So risk stratified follow-up tailored to the individual cancer patient. At the moment, when you have follow-up after you finished your treatment, it's quite depersonalised. I think they give you like an annual meeting where you see someone and they do some tests, say, yeah, everything's fine, yeah, are you okay? Yeah, I'm fine, and off you go. Well, this is going to be a more personalised approach, and it's based on risk. So I imagine that's going to be for your personal circumstance, and also the type of cancer you've got and what stage you're at, all that sort of stuff. So I was asked to nominate which one of these groups I wanted to be on, and I didn't really mind, but I've actually said I'll go for the third one. My reasoning is that if it's risk stratified in terms of the type of cancer you've got and the chances of it returning, then I'm thinking if I get involved in that one, I might find out a bit more about my own risks and the chances I've got and whether it's going to come back, and a bit more information that maybe the surgeons or the doctors and the nurses are maybe less willing to give me because it's an awkward conversation. So I'm thinking if I get involved in that particular group, I'll pick up a bit more information. The idea is I think these meetings take place every month or two. It's online, which is fine. I don't have to go anywhere, and I tune in as a patient rep, and there might be one or two reps involved in each meeting, and we're listening in to the clinicians all having this discussion about what they want to do, and we get an opportunity to give our input as a patient. So I'll let you know how that goes if you're interested. Well, in fact, I'm going to let you know anyway. If you're not interested, you can just not watch the vlog. That's it really, isn't it? So yes, shielding now. Christmas is coming, a few days away. I hope you're all ready for your Christmas. I'm ready for a Christmas day with my family, but I'm not really getting involved in any parties or anything like that much because of the risk of virus, I'm afraid. Anyway, so I'm going to wish you all a very Merry Christmas and a Happy New Year. And I'll see you soon. Bye for now.